Hi, this is Angie. Can you hear me?
Yes, we can.
Good, because I'm just getting done right now.
Hi, John.
Hello. How's everyone doing? I'm a little dark here. I don't quite know why.
Yeah, I have problems with lighting too.
Gonna do a sound check.
Hello. How's everyone doing?
Sound works. We are all set. We are live and set to go.
Okay, well, I am working with a new computer at a new location, and I may not have my camera working. I'm seeing just my name up there, and then of course the rest of you have your images. So it is what it is. I can hear you. Anybody want to say hi so I can verify?
Hello,
Hi,
David.
David.
All right.
Congratulations on your new computer.
The gang is here. Okay, so I'll just probably be non-image today, but that's okay.
Sandra, I sent you an email with a recommendation for the doctor.
And I sent you a response back to provide some direct contact information if you have a
I
chance.
certainly will. I had lunch with them today.
All right, thanks.
All of you look good tonight.
Thank you.
You're a good liar.
No, I'm not. You do. I have the most colorful screen in front of me.
That's Cheryl's picture. That's why.
Isn't that something? That's a big plant behind you. How'd you carry it?
Oh, if only I could. I just found it as a background. The one in front of my house is probably a third that size.
I wanted to ask a procedural question. Pat, you remember, or somebody, if the committee has approved the minutes, then we don't have to do anything with it on the board, right?
Yeah, that was my understanding. If the committee has voted on a set of minutes, that's the way I've always understood Robert's rules.
That's what I thought, but I wanted to make sure before we got to that part for us.
Yeah.
Okay, good. We're getting so many people on this meeting. I'm gonna have to get a bigger computer.
Maybe you could live stream it into your television set. I don't know how to do that, but
Yeah, right. I don't think my wife would like that.
probably not.
You just need a bigger monitor.
Yeah, I do. I'm working on a laptop, so everybody's getting smaller and smaller.
If you guys can look behind me, look at the monitor on the desk behind me.
Yeah.
That is my husband's, on which he can open at least 3 documents at once. And apparently that's good.
Only if you know how to do it.
I have to admit, we cheat as well. Most of us have 3 monitors. The unfortunate part is our camera is located on our smallest screen. So you see us looking at weird angles because depending upon where you can fit your Surface Pro or the laptop, which is driving it. So some people are more adept at it or depending upon their office space. But yeah, it is I kind of standard anymore to have that, to have multiple documents open, as well as when you go to screen share, that's the challenge, making sure you've got the right screen up that you're sharing. So.
Excellent, excellent. I hope everyone can hear me. And it is currently 6:30 on September 21st, 2021. Glad to see all your happy faces. Are we streaming yet?
Yes, we are live and ready to go. Sorry.
Okay. Oh, yep. There it says live. Okay. Okay. So we'll have. Do we have any guests or public participation?
No guests today.
Excellent. Then we will have approval of agenda for September 21st, 2021.
So moved.
Second.
Excellent. Any discussion? All in favor?
Aye.
Aye.
Any opposed? Excellent. Approval of minutes from August 17th, 2021, located on page 4.
So moved.
Any second?
Second.
Excellent. Any discussion, changes? All in favor? Say
Aye.
Aye.
Any opposed? Excellent. Presentations, COVID-19 local perspective update.
Good evening, everyone. I'm going to go through this as I have the last few months, and we'll go through it relatively quickly. Let's see if I can share the proper screen. Are you seeing the presentation?
Yep.
Yes.
Okay. Because now I'm not, but I'll trust that
You may
you
want
are.
to do a full screen view.
That's fine. I have the presentation up. We begin on page 8 of the document. Okay, I am having an issue with this. Sorry. Seem to have lost my view. All right, I'm not seeing my screen.
Just scroll down here.
I've lost
Scroll
my.
down. Get the rest of it.
So let me come around. All right, so we're on page 8, the current snapshot of where we are. Just a couple things on here. The positivity rate we're showing as 6.4 as of earlier this month. It's dropped down to 4.9%. Vaccination rate continues to increase. On page 9, again, sort of, this is from the CDC. This is the overview of what's going on in Illinois. You can see spring, we were coming out of the 3rd wave. June and July were looking pretty good. And then the rates have gone up across the state. Right now, transmission is high across all of Illinois.
And Peter, we may want to kind of reflect back because it was a discussion point as well for our command center about the positivity rate and why that's dropping despite a high case rate. So maybe just so everyone's clear on that.
Yeah, thank you. Yes, one of the things as I noted on here, that the positivity rate has dropped with all the changes that are coming through relative to required mandated testing for people who are not vaccinated or in different settings. The number of tests is going to be increasing. We'll see that go up steadily. And since the positivity rate is really the number of positive results over the denominator of total tests, as more as schools and employers and other locations are doing those required tests, we're going to see the denominator continue to increase, which will drive down the rate. And so when we look at things like the case rate per 100,000, that tells us a little bit more about what's actually going on in the community right now. That's a rolling 7-day rate that you see. So that tells us more about what we're really seeing. And that's why the state has gone red. That's driven more off the case rate. But what we are likely to see the positivity rate continue to decline as that denominator goes up. And so it's just something to bear in mind. Sometimes some of the numbers may seem counterintuitive at times because they don't really, they're operating off of different, they're capturing very different information. Again, this is sort of what the state looks like right now. The CDC's forecast is that the Illinois rates overall will stay relatively flat or be declining over the next few weeks. Winnebago County is projected to be pretty flat over the next few weeks, but hopefully we'll start to see some improvement on that. Again, this is sort of that overview of the cases where we see the different peaks of cases we've had, the infection rate, the vaccination rate. This is coming off of COVID Act Now, which is a good aggregator of the data. I'm going to skip the next few slides. These are, again, I'm keeping these slides in here really for documentation and tracking purposes. When there's a change or something to note, we'll really call those out. But in many of the cases, these things are just sort of, we don't really see significant changes over time that you'll catch it if you read the commentary, but for the most part, they're nothing we need to call out during the meeting. On page 11, I'm going to come to the cases over time. Again, these are sort of another way of reflecting the cumulative effect of COVID. You see the 4 waves. One, there's the big one last fall, the early spring, and then this is the current one. You see those jumps up on the total case counts. And the other way of looking at it is by dates of onset of illness. And you see our 4. And again, last month when I reported, this 4th wave was we were just capturing the beginning part of it. It didn't look so severe, but it has continued to be pretty, unfortunately, almost as high numbers as we saw in the spring wave. Positivity rates, I'm going to skip again through these, really because we're not seeing changes over time. These are pretty stable. This slide that looks really at the age of, we hear a lot of discussion about the age of the COVID patient and that they're getting younger and who are they. What we're seeing now is, we've sort of watched over the months as these different age bands have increased. What we're seeing now based on sort of the early September data was that this youngest group, that 0 to 9 group, is making up a larger percentage of the total cases. And when we come to the school data slide a little bit later, you'll see again that, so that's a lot of those younger folks, in this case, those are too young to even be vaccinated, are making up an increasing portion. So fully 30% of the cases are those who are 19 and under. for what we're seeing in September. And that's up again from what we saw last month. And just one other sort of point around this is, over the course of the entire pandemic, the average age of the COVID case has been right around 40 years old. What we're seeing since August 1st is the average age is around 36 years old. So we are seeing that drop in what the composition is of who those cases are. Again, race and ethnicity really has not shifted in prior months. It's been very stable. Ethnicity continues to look the same as it has. The case rates continue to go up, and the disparity, particularly in the Hispanic Latino population, continues. The same relative to age and gender has not changed, and the deaths by race and ethnicity has been very stable for months. We're really not seeing shifts in there. The percent that are actually hospitalized has been pretty stable across time. I just want to briefly pause here. We're looking at hospital admissions and ICU use. We hear a lot about the impact on hospitals and how they're being stressed. I know some of the hospitals in our area have needed additional staffing support. Again, you see this, here's the fourth wave, and those numbers of admissions for COVID-like illness have been going up, and it's spreading out over a little bit more time. And our ICU availability has continued in the region to run below the 20% threshold. So again, this was the earlier wave in the spring. This is the current wave. And you see how we're being impacted, and our hospitals are being impacted. Communities of concern, where we see the rates, we see a little bit of fluctuation within that group, but essentially usually 4 out of 5 are not changing month over month. We're still seeing those same communities having the highest aggregate rates. Very briefly, relative to schools, and Dr. Martell may want to talk about this a little bit more in terms of what we're doing with the schools. By the IDPH website, we have one, Hononegah High School currently has an outbreak of 5 to 10 cases. They are reported as students through sports activities. What we are seeing, though, this is looking at, over time, the different age groups of students, and this blue line at the top are those aged 5 to 11. And you can see that they've spiked up. And that's, again, sort of what we saw in the age distribution. We're just seeing more cases at this youngest age group. The college age, that green line was running higher, but is running lower right now. And certainly the governor has come out with new guidance for schools, and there's been a lot of discussion around that. I don't know if this would be a good time for Dr. Martell for you to share some of what's going on with the schools, or if you want to wait for the question and answers time.
Well, I think that probably Todd Kisner can also weigh in on this. But, obviously the concern is, as you look at that, we know that the 5 to 11-year-olds cannot get vaccinated, right? So the reason that those numbers become very concerning is the population around them. And so you've heard a lot of discussion, the mitigations we've talked about. We continue to monitor very carefully. And the philosophy that you're going to hear us report is most protective, least restrictive, right? So we have different models of quarantine that we can use in schools. And again, last year it was all very straightforward and clear, and our school nurses and our schools all understood. Exposed, it's a 14-day quarantine. Now we're doing more, and Peter alluded to it with the test. We have test to stay option, meaning if it's a close contact in a school environment, that's the exposure. then they can, if the family is agreeable to it and consents to it, they can test on days 1, 3, 5, and 7 and remain in the classroom with a mask on. And in school environments, it's 3 feet, not 6 feet. So a little bit different in there. There was data that came out supporting that in the younger populations. As we get into others, it could be a 10-day quarantine if you only want to test once. And so we can test you before you return at day 10. And of course, for families that choose to not test, then they would be out for the 14 days. So in any given classroom scenario, you may be hearing appropriately that they're undergoing different quarantines based on the family's choice about the we're going to go out with what it is in terms of who is involved in that group with the school nurses and what the exposures were. But then within that, families have some choices about if they're going to test, then they can test at various times. If it's a fully vaccinated student, which you may get into like the grade sixth grade and above in the middle school, then they do not quarantine. They simply recommend that they test about day 3 to 5 and then return them to the class, without any further concern. So there's different models going on depending on what the family chooses and then the vaccination status of the student. And I believe we've had 2 outbreak statuses within schools, both related to sports. Todd Kisner did, maybe you can weigh in on that. And right now, a definition of a school outbreak is really 2 or more what we call epidemiologic linked cases. So while there may be 2 cases in a school overall, if they're not epidemiologically linked, meaning in space and time connected, then they are not classified as an outbreak. And of course, the challenge has been we saw the early initial outbreaks occurring in the sports team and the extracurriculars, very similar to what we saw last year. Was the extracurricular that drove infection or any transmission within a school. But we're starting to see some stabilization. And Todd, maybe I don't see you on the screen.
Can I sneak in a quick question, Sandra? Has
Sure.
there been any talk at the state level as far as sports, because of the close contact and the sharing of the ball and things of that nature, of requiring people who participate in IHSA sanctioned sports to have a COVID requirement? I mean, because you do not have the right or privilege to do sports. I mean, you have certain grade obligations, things of that designated by the state. Has there been talk by IDPH or anyone else at the state level to decrease the transmission in the sport environment of requiring vaccinations? Because there's no way you're going to not spread COVID playing football or basketball or volleyball.
So Dr. Williams, yes, they have. In fact, I think there was a lot of discussion that we probably, when you think about some of the actions that as an after action, you might say, bring the children back into the academic learning environment first, and then have added on sports after you got things stabilized. But most of the sports seasons, as we know, start ahead of the academic school year. So that was probably another challenge that as we looked at what was going on, we brought to the attention of IDPH. Right now, the coaches and things like that within the school settings, or those, whether you volunteer or not, you are also subject now to what we'll call the vaccine and testing requirements of schools.
Okay.
Okay. Moving on to page 18. This is about our vaccination status. And again, these are the statistics of this is what the IDPH posts on the website in terms of vaccine doses and what the distribution of cases are. We continue to increase the percent vaccinated, but it's definitely slow going. This is the chart of vaccinations per week, and there certainly has been an increase in vaccinations after the real slowdown in July and August, but the numbers are low, and certainly the term of demobilizing from mass vaccination into incorporating the vaccination efforts into sort of regular ongoing efforts here at the health department on Wednesdays and Saturdays, and then the other vaccination activities. Again, I would invite Rebecca or Dr. Martel or anyone, if there's questions about vaccination, to feel free to jump in here.
Well, probably the other thing too is I think everyone had hoped for a little bit more of a bump up in the rates of vaccination toward the end of that tail of September, with more of the requirements coming out. We are not seeing that quite yet. While numbers are increasing somewhat, slightly, certainly nowhere near the bump that had been, I'm going to say, initially hoped for with some of the requirements coming out.
Okay. And I'm going to skip through the congregate settings in long-term care. There, we are seeing some outbreaks in long-term care settings. Those numbers are much lower than they were early on. This data is very stable and really barely changes. The number of deaths are relatively low. I mean, we're seeing, just as in the other data nationally, with people being vaccinated, those who are vaccinated are less likely to have severe cases, and the death rates are lower for those. So some of the numbers of deaths, thankfully, is something that we're not seeing an increase, even though we have seen those cases going up. All these are stable and are not really changing. And then just sort of the last couple slides I'll touch on. Again, from the IDPH website, this is our weekly tracking across the state. If you're in Orange County, you have 2 or more warning indicators. Last month, we had 3 warning indicators. We also tripped the indicator for COVID-like illness ED visits. On this most recent update, we're still triggering it on the case rate and ICU availability, which we've certainly chatted about. And you can see, at least there's some blue in the state where some of the numbers are coming down. And then again, looking at things on a regional basis, ICU capacity and inpatient hospitalizations still continue to be below the targets. We are seeing some daily decreases in inpatients. That's what those blue dots on the bottom of those 3 graphs are, increases in inpatients. The orange dots are decreases. The good thing is at least we're seeing some orange dots, which hopefully will indicate that the hospitals may get a little less stressed as time goes by. We still, on that middle chart, are in the red zone. That's the ICU availability. We've just, as a region, been running below that 20% threshold. And that's the update that I have for you this evening. Any other questions? Okay. Thank you very much.
There's no president's report or executive committee report. Finance.
All right. First, can everyone hear me?
Yes.
Yeah.
Yes.
Good.
Yes.
All right, I'm going to switch off so I can try and work between 2 computers to get this going. Bear with me one moment. Okay. We will move to Finance Committee. I need a motion for approval of minutes from September 15th, 2001 Finance Board.
Move approval.
Thank you. Do I have a second?
Second.
Discussion? None, and all in favor?
Aye.
Aye.
Opposed? Minutes passed. We will move into our financial statements. First is our resolution of expenditures found on page 26. Again, bear with me. All right, hold on, I'm losing my information. I apologize.
Do you want us to put it up on the screen for you, Dr. Halverson?
That would probably be even worse.
Okay.
That's, I just have to advance and all right. All right, first motions are Health Department expenditure incurred during the month of August 2021 in the amount of $881,074.33. I need a motion to approve.
So moved.
Second.
Second.
Thank you. I have a motion, a second. Any discussion? If none, all in favor?
Aye.
Aye.
Opposed? So passed. We will move to our statement of fund balance. We are in our 11th month of our fiscal year. And we have a net decrease, the previous of $645,088.07. Any questions concerning the fund balance? We will move into our financial review for the 11th month, Winnebago County's fiscal year, and the second month of Illinois State's. We have a revenue with a budget of $13,184,000 and actual revenue of $10,224,000 with the variation of $2,959,000. Our expenditures for the year to date, we had a budget of $13,633,000. Our actual expenditures for the year so far have been $10,869,000. A variance of $2,763,000. We have any questions or concerns of that? If not, we'll move to page 28. I'm sorry, I am thrown. That was our financial review. We will move to our balance sheet, which is our, let's see, found on page 29. You can see it. So total fund balance, bottom, and our total liabilities. Any questions concerning this? If not, we will move to our bank reconciliations of the 4 accounts. First being a general account with a August 2021 balance of $360,539.08. We have our bank, our abandoned properties, which carries our minimum of the $5,000 per month. We have our bank reconciliation of Illinois ePay. Oh, I'm sorry, I missed the lead account. I'll go back to that after this. Of $358,727.65. For our lead account, we received and distributed some cash this month. That can be found on page 33. So we have a current balance of $146,285.22. Do we have any questions concerning the bank accounts at this time? And Jim, do you have anything to add to these?
No, things are going along pretty smoothly, finance wise. So, just our receivables will probably build up the next month, but essentially nothing unexpected at this point.
Okay, we will move to the revenue and expenditure reports. Anything, comment on those?
I think we're pretty well up to date with our recording our expenses and our revenues. So I'm anticipating that we'll come in after at year end within our revised budget, which is a deficit of 489, 367. Like right now, we're running at slightly over at 645. But I think we'll be within that range.
And to be clear, that reflects both the waiver on the permits or the delay in the permit fee.
Correct. That would be without recognizing any revenue with regards to the food service permits. And I know that we have monies coming in from the host fee. And also we had the a hit with our expenses for the Qualtrics system.
Right. So we actually are doing better than we would project based on all of that.
Right.
May I ask a question? Since most of the restaurants seem to be open now and other facilities, are we going to start going back and collecting the permit fees? And when are we going to do that?
Angie, that was a decision the board made to waive the 2021 food permits, so we will not collect them until 2022.
Okay.
Then that was, again, we're working through the board because of the use of the American Recovery Fund. The ARP funds are supposed to be allocated to us, but it won't be recognized revenue for this fiscal year. It'll be put into the next.
Okay. Now that you said that, I remember that. Thank you.
No problem.
Any other questions? None, we'll move to our revenue, our emergency reserve minimum graph. We are a fraction below where we were last year, but we are still well above our minimum. We will move into our expected revenues or expected accounts receivable, found on page 47. Jim, anything to add to this or?
We're pretty close. We're up to date with our reports and the collections have been coming in pretty good. Those items in red are estimates because we can't file the reports only quarterly. So, but we're reporting wise and collection wise, as far as through our various grantors, we're up to date.
Thank you. Any questions? None. We will move to major expenditures. We had 2 requests, which the Finance Committee approved a motion to advance the major expenditures, one being IDPH electronic filing fee for death certificates, and one for Shoe Carnival expenditure gift cards, the Wise Woman program. As I said, the Finance Committee recommended these be approved. So, do I have a motion to approve?
So moved.
Second.
Second. Can I be heard?
Now
Yeah.
you can hear you.
I'm sorry, I have a internet connection which is unstable. I'm assuming.
Yeah, you're freezing up, John.
He's freezing up. Yeah.
I've lost.
You may want to
connection.
turn off your camera and then it'll preserve the bandwidth. You can still see your screen.
I can see my screen.
So you
and
can turn off your camera and that may help stabilize it a little bit.
Let's see. Does that seem any better?
Yeah, it looks better.
I'm not sure it's better on my end. I got that. Thank you.
So we had the motion and the second.
We need a vote.
Mhm. Why don't we just do it?
Yeah, all in favor?
Aye.
Aye. Any opposed? Excellent. Are you on, John?
I think we lost him.
I think we did too. Maybe we could just do it. Just keep going and try.
Yeah, Alan, just take it. Alan.
Yeah, I just came off the page. We have proposed contracts agreements. The Finance Committee approved the motion to approve agreements A through E, which is the Swedish American contract, Lincoln Middle School, Jericho project, South Beloit Police Department project, and the Cyricom Vizient Supply and Video Audio Interpretation Services. Of course, we
We didn't do C and D of the major expenditures, did we?
We did.
Those
For
are,
your information.
I
Yeah, for
apologize. I
information.
thought C and D were included. I apologize. C is the modernization and staffing of the service elevator. And D is the modernization of the visitor elevator. But I thought those were already voted on by email.
They were, it's information only.
Right.
Oh,
We just
Oh,
put it
okay.
on there just so everyone can see that it's, part of, that the board have voted on it and it's in the queue. They have not started work on it yet, but they wanted us to get in the queue with facilities so that the parts and all the things they need ordered got ordered earlier, gave us a 3-week lead on ordering.
Right.
All right. So, are you back, John?
I think I'm back.
Okay, you're back.
Well, we won't hold our breath, but yes. So we have that. We will move to proposed contracts and agreements. The Finance Committee approved a motion to advance proposed contracts, letters A through F, A through E. Do I have a motion to approve?
so moved.
Do I have a second?
Second.
There we have a motion and a second. All in favor of approving the 5 proposed contracts, signify by saying aye.
Aye.
Opposed? So passed. We, at a City of South Beloit Police Department, the tobacco enforcement program, we had some questions with that, so we did not advance it. Do we have the further information on that?
And again, yeah, the question, so do we have a motion on that so we can?
Oh, I'm sorry.
So moved.
Thank you. And a second,
Second,
Sandra, I'm sorry.
It's all right. There was, the reason it was held was that there were proposed revisions to the indemnity language that had not yet been reviewed by the state's attorney. And so LaFavon has reviewed it and it is acceptable, so we can move forward on the agreement. Did you want to add any comments?
No, I just want to, I believe no. Does anyone have any questions concerning the agreement? This is, I believe we've done this all just about every year. Involves a police officer and a high school student attempting to buy tobacco products at various establishments, just to see which ones are following the law. If we have no further questions, we have a motion and a second. All in favor, signify by saying aye.
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 Opposed? So passed. We will move to,
I just have one question. So was it
Yes.
approved at finance or not? Or what happened at finance regarding the item?
It was not approved. That was the tobacco enforcement program. The one above it is the naloxone. They did not request the same changes on that contract. It was the tobacco enforcement agreement where the City of South Beloit asked for revisions to the indemnification language. So we sent it back for legal for review. And
So then the Board of Health is just approving it, but it's not going back to finance?
correct.
no.
Oh, okay.
it's just brought straight to board.
Okay, Thank you.
Thank you. All right, we will move to item G, Illinois Department of Central Management Services administering the influenza vaccine. That is new. Let me locate that. Can I have Sam, can you give some insight on that?
Sure.
Can I move approval?
Oh,
Second.
thank you. We have a motion to approve. Do I have a second?
Second.
No. Okay, we have discussion.
This is the annual State of Illinois agreement with their central management services to provide flu vaccination. And this year it's flu combined with COVID to State of Illinois employees.
So there's no cost number on this?
They reimburse us for the provision of the services.
Okay.
There's no cost, you know, they provide us with a flat fee to provide the services.
Okay.
We have a motion and a second. All in favor?
Aye.
Opposed? So passed. Our last proposed agreement is a community vaccination site agreement for COVID-19 and seasonal influenza vaccine. And
Move approval.
thank you. Do I have a second?
Second.
Second.
Discussion.
And this agreement you've seen before. This is a templated agreement that now, because we are providing both COVID vaccinations with influenza vaccinations, we modified this agreement. So in the sites that we're doing both vaccinations at, we have a standard templated agreement for us to provide those.
Any further questions? If none, all in favor?
Aye.
Opposed? So passed. Is there any further financial business?
No.
No, thank you, John.
Oh, thank you all for bearing with this interesting thing. I turn this over to policy.
Excellent. Policy committee.
Okay, so I have on the agenda here approval of the September 15th, 2021 minutes, but the committee has already approved those on the 20th. So we need approval of the September 20th minutes, which we just had that meeting this week. If there is a motion. Is there a second?
Second.
Okay, all those in favor?
Aye.
Aye.
Opposed? Abstaining? Upset? All right. Next thing on here is the Della Tour Drive installation of septic system, which the committee did not take up because the proper requests and information were not submitted. So there's nothing to do on that. There's the agreement between the health department and Prosser Management on a piece of property that we granted a variance in 2009 for septic system. And it was a variance for a undersized system because the site would be used sparingly for wedding receptions, occasionally during the weekend, and on the weekend. Now they've applied for a liquor license and want to have the property used for weddings and receptions all year round. And this is raising concern that the septic system will handle the new increased usage. Since our variance in 2009 wasn't specific enough, they have agreed to have us enter into this agreement with Prosser Management to control or take I know Todd is better to explain this, but to monitor the use of the septic, the water output, to see if it's going to be able to handle the new business. And we're going to get readouts from that and at the end of a year, which this agreement was for, we will then determine if they need to come in for a new variance because of the system not being adequate. Did I get it right, Todd?
That is correct. Excellent.
Yeah.
Thank you.
Very clear.
I was paying attention for once.
Yes, you were. You get an A.
So the committee is recommending this to the board. So that's our motion already. I guess I'll take a second.
Second.
Thank you. Discussion.
Yeah, do we have a feel with the system that we gave them the variance for, that if they do increase their activity, do we have a feel that they're going to exceed the usage? I mean, I read the agreement with them having to email it and everything that way, but if they are modestly successful in their venue, wouldn't they exceed the old variance?
If I could answer that, okay, thank you. Basically with monitoring, what they're telling us, and obviously we will not know until we get a data logger that actually datas the water that's coming in and leaving the facility. They say because of the economy and what they are doing and weddings are getting smaller, they feel they won't even get up to that water usage that is normally. It was seated for 300 people at the time. They're saying they're not exceeding 150 people. The only way I can be able to determine that without actually going to every event up there is actually metering that water. And if the water exceeds, it means automatic stoppage at that time. They have to start the process of doing soil borings and installing additional field or a brand new field.
And my other question is, I see the variance is good for, I think, a calendar year. COVID hopefully should not be around forever. Do we have plans in the future when COVID is more under control and things may go back to what they were and weddings become bigger again, of revisiting this site?
It's not the variance that's a year, it's the agreement that's a year.
The agreement, I apologize, the agreement.
Yeah.
The agreement.
That is true. The conversations, what I'd like to clarify with the conversations I'm having with the owner out there, they are planning to extend that business. They really truly are. At this time, they are gathering up their own data, I guess their investments and stuff like that, to truly be some kind of supper club up there eventually. That is the conversations that they told me about within a year or two. That's the future of that property. But right now, they just feel that is not in the plans yet. But once COVID is done and everything starts increasing, they will be coming back in to install a larger system that supports their future application there.
Okay, that was it. Thanks.
Yep.
Any other questions? All right, all those in favor of approving the proposal?
Aye.
Opposed? Okay. Personnel policies. The committee has recommended all 4. We did vote on the other 2 this week. So all 3 are being presented by the committee as motions. First one being the vaccination policy for employees, interns, students, volunteers, and contractors. Is there a second to that motion from the committee?
So move.
All right. This covers, like I said, employees, leadership, interns, students, volunteers, contractors. It does not cover the Board of Health. And we've made some adjustments to it to make sure it covers everybody that we want to cover and covers everything we want to cover. The best person, I guess, Sandra, if you want to talk about it.
This was to, first of all, under the executive orders issued, as well as kind of a leadership position for the Winnebago County Health Department, as you've seen, as a healthcare provider and as a recipient of both federal and state funds to really kind of lead by example by establishing the vaccination policy for our employees. And again, it's interns, students, volunteers, and contractors. And that does not mean someone who's coming in to repair our elevator. It is for individuals whom we have subcontracts with to provide services, like when we brought forward contracts for our infant mental health, or we bring in a contract for our medical, our CMO. Those individuals would be required to be vaccinated under this policy, and or if they don't, if they have an exemption. So, we call it a requirement of vaccination, but it also deals with the exemption portion of it. So if they have an exemption on file, then they'll be required to test as part of the process. So again, there is the exemption process that goes into play.
We've also added an appeal process in there for the exemptions.
What is an example? Who are the volunteers that come and go?
What we have, Jennifer, are what we call our Medical Reserve Corps is our largest group of volunteers. Those are individuals right now that have been assisting with COVID-19 vaccinations. And today we're working at Durand School with us to provide flu vaccines.
Other questions? All right, let's call a vote. All those in favor of approving the vaccination policy for employees, interns, students, volunteers, and contractors, say aye.
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 Opposed? Abstaining? Next policy is the COVID mitigation policy. We changed the name of it. It covers some of the usual suspects in the Board of Health. We also added some corrective language just so we make sure how we're covering them. Charlotte did some fantastic work, and Sandra and whoever else worked on it, of making sure it was comprehensive. Sandra, did you want to say anything about this?
And again, Charlotte can chime in at any point. This was really an expansion and extension of the COVID-19 mitigation policies that the board had enacted a while back that really kind of talks about what kinds of things are expected of employees outside of, we've got the vaccination policy, but again, what the kinds of requirements are in terms of wearing masks in our indoor environments when there's executive orders, and what kinds of spaces that are there, as well as kind of making some differentiation when we've got some fully vaccinated staff versus staff that are exempt.
Okay, any questions?
Did you say that covers us too as board members?
Yes.
So in part of this, did I read correctly that unvaccinated or exempt folks have to wear masks outside of the building? Is that correct?
I think it says in the parking lot.
Yeah.
Right. Correct. And that was consistent with our flu mitigation policies. If you were on our premises and coming in, so our parking lot would be considered it, again, an area outside. So as you came in, before you come out of your car, you would put your face covering on before you came into the building.
Thank you.
You don't have to wear the mask in your garage, Jennifer.
Don't worry.
Okay. Anything else? Again, it covers board members, so after you approve this, if you approve it, don't complain. All those in favor of the motion?
Aye.
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 Opposed?
Opposed.
Abstaining? Christina, make sure you record the votes accordingly. All right, next one is the Corona employee policy. If I'm getting these in the right order. And this also just covers, I think I'm missing a sheet. Well, this policy applies to all employees of the health department. And I don't know, Charlotte, you want to talk about it, or we haven't heard from you tonight?
I'd be happy to, Ron. This policy is a modification of the prior policy that was in place because of the Coronavirus Response Act that was passed. At this point, we're not required to provide any paid leave to employees, but want to offer 80 hours of paid leave to employees who are vaccinated, who are still required to take time off due to COVID, either because their kids are quarantined or isolated or any other reason they might need COVID related. It does not offer the same for employees who are not vaccinated. It requires them to use their own paid leave.
Oh, and I'm sorry, this is a motion that was brought by the committee, so I guess I need a second before we get too far down the line. Thank you. Questions?
And I want to make sure that it's clear that if an individual has an exemption on file, that they would also be eligible for so for instance, if their child is, if they have an exemption and their child's exposed and they have to quarantine, they'd be eligible for the 80 hours.
Who within the health department would not be vaccinated with the policies that were passed then, other than exemptions? I mean, because wouldn't be. Everybody has to be vaccinated at this point by a certain date, correct? Okay, Red.
I see nodding, but I don't hear anybody.
That's correct, yes. I can get my space bar there. So again, part of it was to make this distinct and clear about the eligibility for compensation.
And there may still be employees who are going through a disciplinary process that would still need to take time off that would be subject to using their own paid time.
Okay.
And if someone were ill and was exceeded that, let's say they were seriously ill, that would then follow under like the FMLA policy after the 80 hours, or no?
Correct. Did they be eligible for either FMLA? They might even be, hopefully, I would hope they'd not have to go to short-term disability, something like that, where they were off for an extensive period of time, but other benefit things then kick in.
Okay.
Other questions, comments? All right, then I'll call the vote for the coronavirus employee response policy. All those in favor?
Aye.
Opposed? Abstain? All right, that's the end of a lot of policies. At some point, we will put out all the policies in a digital version for everybody, along with organizational documents, bylaws, constitution, great thoughts, all those things. We'll send them out to all the board members so that you have those at your hand and at hand, so that you can look up stuff when you want to beforehand, or if things are coming up, you can check it yourself. But when we get a chance, and Charlotte work on that, and the rest of the leadership team, to get you all the digital versions of everything we're working under. The only other thing I've got to say is I'm blown away by the last year and a half of what Sandra and the leadership team in the department has been doing. It's just amazing. I know this has been said before, but it's just amazing to me. All the work, the hard work, what you've gone through. It's one of those things that we prepare for the worst, but we never expect it to come, and here it is. And it's amazing how everybody's handled it. And I'm proud to be just a little part of it. Thank you.
Thank you. Personnel Committee.
Okay, for personnel, can we move that to executive session?
Yes.
And that's all I have.
Quality Improvement had no meeting. Is there any new business or other matters?
John, do you want to talk about the nominating?
Yes. We request another month for the nominating committee. We have run into a couple of questions we're still trying to work out. So we would like to bring this back to the board in the October meeting, if that is not a problem.
Anyone have an objection with that?
That's normally when the slate is voted on, so.
All right.
Okay, thank you.
Change the location there, John. I threw me off for a second. Any correspondence or information or anything else?
Maybe just a follow up to everyone who's received. I understand that many of the board members have received certified letters or FOIAs or information requests. We ask that you submit them to Christina. We will handle them through our FOIA process and response.
Truly appreciate that. Thank you.
Okay. Then, hold on, are we still alive? Yes. So we then need to go into executive session.
I move we go into executive session.
Second?
Second.
Roll call?
Wait 1 second and let me get you off of live. And once I